At one point, because we had such unreliable staffing, I was working the 6 days a week, and my stepson came to me one day and asked me, do I have to move? What? Why would you have to move? You don't love daddy. Excuse me? You're never home.
I mean, it was awful. I mean, I hated going in there, but at the same time, I was grateful that I was there to clean up everybody else's messes too, you know? Going in there and seeing that someone's wearing the same depend that I put on them yesterday. When the last time I saw them, you have one hall to yourself, and that's still 2 to each room. That's 10 rooms on that hall, you know, it's 20 people to one person, maybe 2 if you're lucky, and you still have to hurry, and you have administration walking you know, hurry and get so-and-so down to breakfast, you know, and I'd show up and half the people sitting in there looked like they got dragged out of bed and didn't get, you know, they have dried food from yesterday on their faces, and their hairs haven't been brushed.
For effective care, you need to establish a relationship. And if you aren't able to establish that relationship, everything is harder. Everything is harder. So I immediately went in, and I had all these residents and all their medications, and learning all their faces and trying to make sure that I was giving them their medications the way that they would take them. And then, so initially it was a very slow process, and I would be late on my medications. And there was nothing I could do about that because I was the only medic there.
She was discovered in her room by a caregiver, naked, freezing cold, feces spread all over the room, her bedding, and totally incoherent. And they called, she had told them to call her son to come get her. And my brothers were never ever involved in her care in Oregon. I was always the primary caregiver and had the power of attorney. And they called my brother in California that she wanted to see him. And then he called me and said, what's going on? I happened to be out of town in Seattle that day, and so I called my daughter. She went down there with her husband, and she had been left in that condition through this whole telephone tree process that went on until my daughter and my son-in-law got there.
I think she went in thinking that there'd be like actual compassionate people there who would, you know, look at your mother and be like, oh, she's a real person. I'm going to treat her as such. Unfortunately, it seems in my experience that people in the facilities are just a number to them. They're just a way to, you know, fill beds. They just want the money. In one experience that I had, we had a guy move into the memory care facility who he probably did have like the beginnings of dementia, but he was not ready to be in a memory care facility. And this was a man who knew exactly what he was doing. And the first day he was there, he immediately started terrorizing the female residents, like just trying to get them to like take their clothes off and like do things that they did not have consent for. And again, he knew what he was doing. He was very conscious about what was happening. And I brought this up to the management, and she basically told me that, oh yeah, okay, that's fine, but he is a private pay. He's private pay, so basically I don't care, because we're getting lots of money from him, and we're just going to have to deal with it.
Right.
And her response was just to watch him 24/7, just have one person always there around him to make sure that he wasn't doing that.
Because we don't have a minimum resident to caregiver ratio, the promise is that facilities will follow the rule. And what the rule says is that the facility needs qualified, sufficient, awake caregivers to meet both the scheduled and the unscheduled needs. And so in these stories, what we're hearing is, you know, Sue's talking about her mom, you know, and she ends up in this horrible situation where she's in a state of undress. She's been left alone long enough, you know, to have a terrible experience with her personal care. And the point is, that doesn't just happen out of the blue. Certainly memory care residents can present with erratic behaviors and go from being okay to not okay the next moment. But in this instance, we've got a resident that became dehydrated. And when you already take a sensitive person who has a neurocognitive disorder, and then you add dehydration or additional stress or a UTI on top of it, things can go from not okay to really bad in a heartbeat.
There were plenty of times that I was doing all 3 buildings, and there was an 8 o'clock pass in all 3 buildings at one point, and so
Yeah.
I had 1 hour to medicate residents in all 3 buildings. So I'm running between 3 buildings trying, and you have to make sure you, no matter what though, keep a smile on your face, because you walk up and take your meds and they're gonna no. Excuse me? Wander off that way.
How many residents is that? 3 buildings?
If all 3 were full, then you're looking at 45 residents.
Okay.
But split between 3 buildings
Yeah.
where
You're running.
Right.
punch the code out. Okay, I'm out of
Yeah,
this
'cause
building,
you-
run to this one,
Yeah.
punch code in, get in this building, gotta run around to my med card. The biggest one was always our falls, if
Mhm.
we had a fall, because you have to do a full assessment,
Yep.
and then you've got to make sure that your paperwork's filled out properly, all your vitals are taken, all of it's documented. I was one of those that I'm like, nope, I have to make it down my checklist, but at the same time, I still need to make sure that I'm being both caregiver and med tech to all the other residents.
And meanwhile, there you can't know
I
what's going
can't
on
leave
with
the
them.
person who's on the floor until I get them up. I have to wait for somebody to come from another building to help me get them up, because every person's supposed to get up with 2 people.
Mm-hmm.
So it's like I'm sitting there, okay, come on, somebody, give me somebody now.
I hear regularly from administrators in my area that there is a staffing crisis in long-term care, and they act mystified by that. But the truth is, this is hard work. This is skilled work. You are asked to stay late, work overnight, work morning, work afternoon, work overnight in the space of the same week. How much would you need to be paid? You know, and this is what I want policymakers to ask themselves. How much would I need to pay you per hour to change a dirty diaper on a 250-pound man? You tell me that, and then we can have a conversation about what caregivers need to be paid. And again, you know, I'm not the advocate for workers, I'm the advocate for residents, but the fates of the workers in these facilities are tied to the fates of the residents that live here. It's scary not knowing how to operate a Hoyer lift and having to transfer someone. Imagine being that resident. It is terrifying. The consequences for residents are poor oral health, humiliation, not being able to get out of bed for days at a time, not having anyone notice maybe that you don't have your dentures, and that's why you're only eating the mashed potatoes on your plate. So the stakes for residents are incredibly high.